Have you ever thought about what it would be like to give birth in the medieval era? Childbirth was known to be a dangerous and difficult experience for many women. As a GP or family physician, I can say that a lot of practices and procedures that we take for granted when delivering a baby nowadays were either not available or unknown at the time. It also seems that there wasn't as much focus on antenatal care in the medieval era, and there weren't many medical options for managing complicated births either. So let's explore this topic some more in this video. If you enjoy comparing medical practices through different ages, then please subscribe to my channel, Doctor of the Ages. Midwives played a crucial role in pregnancy care, but these were not like the trained midwives we have today. They were usually women who had practical experience in childbirth and also gained knowledge through observation and practice. In the medieval era, there was no formal antenatal screening or care, so that meant there was no system for monitoring the health of the unborn baby or mother. Instead, attention was given to specific concerns or complaints, like pain, bleeding, or other pregnancy-related complications. Midwives and women with experience in herbalism could suggest herbal remedies for various symptoms of pregnancy or to help with the labour process itself. Raspberry leaf was often recommended and consumed as a tea, tincture or tablet. It was thought to help prevent miscarriage, ease morning sickness and reduce the length of labour. There isn't really any strong evidence now to support its effectiveness, and it can in fact be unsafe as it can cause strong contractions if too much is consumed during the end of the pregnancy. Ginger was also recommended, and actually this is still used by some to try and ease nausea and vomiting, particularly early on in pregnancy. Monitoring the health of the pregnancy relied mostly on observing physical signs and symptoms, so midwives would assess whether the woman was experiencing the expected physical changes and growth during pregnancy. These included weight gain, breast enlargement, and what they call quickening or first fetal movements. There were very few means to detect complications in pregnancy, such as preeclampsia or gestational diabetes. If a woman did experience any unusual symptoms, like pain, swelling or bleeding, then she might seek help from a physician. But unfortunately, many of these cases resulted in dire consequences due to the lack of medical knowledge or treatments available. Most women gave birth in their homes, surrounded by family members and midwives. Childbirth was often seen as a private and family-centred event, but in some wealthier or noble households, servants or other attendants might be present. So predominantly, the woman's family was responsible for providing support during labour. The management of labour for women did significantly vary depending on their social class. Wealthy women might have access to physicians and experienced midwives, whereas lower class women would generally rely on local midwives with informal training. Childbirth was dangerous during the medieval era. Without modern medical techniques, the risks of maternal mortality from common complications like postpartum hemorrhage, which is excessive blood loss, or infections, were high. Complications like breech birth or prolonged labour could potentially result in the death of the mother or baby, and there were very few effective interventions available to prevent this from happening. So physicians were sometimes called upon in some cases if complications arose, or when the mother or child's life was at risk. So let's look at the role of the physicians and what they could do to help. So in cases where the baby was positioned incorrectly, physicians might try and manually adjust the baby's position. This was done with great risk, as at the time there was limited understanding of how to handle the fetus safely. Other techniques like changing the mother's position, such as having her kneel, squat or lie on her side, were recommended to encourage the baby to move into a more favourable position for delivery. They sometimes use rudimentary tools as well, like tongs or clamps, to assist with delivery in cases of obstructed labour. Now we would use the more modern forceps in these scenarios. Bloodletting was commonly used for a lot of ailments in medieval medicine to try and balance the body's humours. It was surprisingly used for women in labour as well, especially if complications like retained placenta or postpartum hemorrhage occurred. To be honest, taking more blood from women via bloodletting in this situation would most likely worsen these complications. Different herbs including opium, wormwood, sage and birch bark could be used to manage certain symptoms of labour like pain and swelling. Alcohol in the form of wine, ale or stronger spirits was also commonly used to try and relieve labour pain. None of these techniques though will have been as effective as the pain relief and anaesthetic options we have now. Caesarean sections weren't unheard of in the medieval times, but they were performed in extremely rare cases, such as when the mother was already dead or dying. The high mortality rate for both mother and child meant that this intervention was only considered as a very last resort. In cases of retained placenta after birth, physicians sometimes attempted to manually remove the placenta. Unfortunately, this often led to infections or further complications due to there being no proper sterilisation techniques or understanding of risks involved with this procedure. After the birth, the mother's recovery was typically managed by the midwife, who would offer advice on rest, nutrition and care. In some cases, if the mother survived childbirth, she would be left to recover with minimal medical intervention, unless of course complications arose. So I hope that we can understand and appreciate that giving birth in the medieval era was very different from today. The main differences highlighted were the lack of antenatal care, monitoring, pain relief and sedation methods, and also the means and knowledge to deal with complications, which made it a very risky event. If you enjoyed this video, then please do like and share. And furthermore, if you want to learn more about how medicine has evolved through the ages, then please do subscribe to my channel, Doctor of the Ages.